Good afternoon, all dear participants and my dearest students. This is the fifth day we have been celebrating Mental Health Week from 7th of October, and every day we have been discussing on very, very crucial issues. Mental health, it is very, very important in our lives. However, it is not always possible to keep up our positivity. Sometimes there are difficult times, there are difficult situations, there are difficult people, and a very, very high chance appears to us that we give up. We give up on ourselves, we give up on situation, we give up on people. Sometimes we want to give up on the life. Today, we are going to discuss about how youth is responding, how youth is considering suicide as one of the options. And mainly, we are going to discuss how to prevent the suicide that is taking place. This is very, very increasingly among the youth. We have with us Dr. Kirti Tandil. He is a brief introduction of our guest. Dr. Kirti Tandil is a psychiatrist, a consultant psychiatrist at Manasparsha Clinic, a beautiful mind initiative at Virar, Vibha Psychiatry Hospital, Virar, and head of SMILE, a SMILE program, School Mental Health and Integrative Learning and Education. An alumni of BYL Nair Hospital, Mumbai and Western Railway Hospital, Mumbai, Dr. Kirti secured first rank in postgraduate university examination in psychological medicine. Dr. Kirti currently practices primarily at Virar and at various places all over Palghar district in the field of psychiatry and mental health with the goal to promote positive mental health and eradicate the stigma associated with psychological and mental health issues. As far as Viva College is concerned, Dr. Kirti Tandil has been associated with us for the last 2 to 3 years, delivering lectures to different groups of schools focusing on their mental health. He has been very, very effective and very, very popular in Viva College. Soon, you are going to, I will not come in between you and him. You will notice why he is so popular and so famous. Dr. Kirti, I welcome you on behalf of Viva College from both the Vice Principal and all the Managing Committee. Sir, the dais is yours. You can begin.
Thank you, Rashmi Madam. Thank you so much for the warm welcome. A very good afternoon to you all. My regards to the Principal, the Vice Principal, the Coordinator and the Convener, and to all those who are attending this program. So I'll just quickly start my slideshow. Can someone just confirm whether you can see the slide?
Yes, sir.
Yeah, thank you so much. Okay, so the topic given to me was about suicide and how to prevent it in the youth population. So I have just named the presentation as "Death is not the answer." Okay, so when we are talking about this presentation, I'll just give you a brief overview of it. It's as simple as you can see it on the slide. I'll be talking about a few statistics so that you get the gravity of this issue. I'll be clarifying a few misconceptions too. And whenever we talk about prevention, as we all know that we basically divide it into 3 categories. That is a primary, secondary, and a tertiary level of prevention. So I'll just, I've tried to simplify the preventive measures in those 3 categories. And lastly, we will conclude with a take-home message, a positive message that we can take from this presentation. So suicidum, okay. Now, when we are talking about this word suicidum, as we all know, suicide is not a recent topic. Okay, it's not a recent entity that has just cropped up within the last few decades. It has been there since over the years, over the centuries. Now, suicidum is a Latin word which means the act of killing oneself. So when right now, if I ask you to just open up your Google News tab, and if I ask you to just type the keyword as suicide and just check the news result in the last maybe like 7 days, I'm sure you'll be getting a lot of uh, headings like this. So I'll just read it out. Sorry, I turned out to be a waste. IIT Hyderabad student commits suicide, leaves haunting note. Medical aspirant commits suicide after failing to get admission. You all know about this case in Nair Hospital. Maharashtra, depressed software engineer and the mother commits suicide. Class 10 student commits suicide in hostel room. And another coaching student commits suicides in Kota. Gurgaon, doctoral degree holder commits suicide after killing wife and children. And we all know what happens in our state over the years as farmers are concerned. So suicide is rampant, and we need to talk about it. Here, I would just like to share my thoughts, my experience with someone known to me. I was in my first year of my MBBS, so the undergraduate days. So we were what, like 17 or 18 years old. And as you know, in the first year of medical curriculum, we have this subject called as anatomy, where we study the human body on human corpses. So we have this dissection hall. We were divided into groups of 6 with 20 students in each. So we had this one wonderful boy. He was very happy, very happy-go-lucky personality. Always used to joke around us. He used to make jokes. He used to make us laugh. So one fine day we noticed that he wasn't there in our group when we were doing the dissection. For initial few minutes, we were not it wasn't so prominent. But then later on, we got a call in the afternoon that he hanged himself and died by suicide. That was really shocking for us. We were just in our late teenage, and one or two people in our group even fainted hearing that news. Now we were not prepared for such a news at such a young age. But then that is what I want to know, that I want to tell you that this suicide is something that is very prevalent in our society. People do not talk about it because people are probably afraid. People have a lot of misconception about this entity, and I'm sure even with you, you might know someone, some family you might have heard about who has some or the other member who has unfortunately died due to suicide. Now, this statistics is something which we are really not proud about as an Indian. Now, as you can see, the maroon dot over India is significant, and it states that about more than 15% out of a population of 1 lakh have died due to suicide. That's a very huge number. When we talk about this graph, it is basically showing the deaths that have occurred due to suicide in different age groups. And as we can see, we are talking about this age group, this early adulthood and the late teenage, which is very prominent. What are the causes for suicide in this age group? Well, mostly it is about the family problems, the relationship issues. Drug addiction is one of the most important factor which results into overdose, and hence people die due to suicide by doing drug abuse. And of course, major illnesses can also contribute to this suicide. When we talk about modes of modes in which people commit suicide, is now it can differ as per the age, it can differ as per the gender. As you can see, when we talk about females in our country, fire or self-immolation is one of the important way in which they die due to suicide. Also in males, the modes are more like cruel, and they usually intend to complete that act, and hence acts like running under the vehicles or jumping off the building, overdosing as far as alcohol is concerned, and sleeping pills and self-injury. All these are seen more in males. And again, as far as the age group is concerned, again the later teenage and the early adulthood are the more common age groups that we see as far as suicide is concerned. When we talk about India's share of the global population who have been suffering from various psychological issues and then resorting to ending their lives, that proportion is increasing. As we can see, from 1990 to 2016, the women population who have died due to suicide has increased from 25 to 36%, whereas for men it has increased from 18 to 24%, which is very significant. Now this slide is something that always hits me, and I'm sure it will hit you as well. So here I would just show this figure to you and ask you to do a random guess what this figure would be. Can someone just guess what this figure must be? You can type in the chat box if you want. Any random guess? We are talking about statistics here. So what this would be? So basically, this is the number of suicides that have happened in the last 12 years in our country. 14,55,931. Just to give you an idea of what this number is, just imagine a plane crash, and then let us just calculate what would be the number of plane crashes that would kill the same number of people. Now, as you know, a Boeing 737 would accommodate at the most 170 passengers. Okay, so if we divide this number by 170, that comes to this, which means 8,564 plane crashes should have happened over the last 12 years to reach that staggering number. Adding to that, this is the figure: 60 number of plane crashes every month, which means at least 2 plane crashes every day consistently for the last 12 years should have happened to reach that figure where we have just calculated the number of suicides in the last 12 years. I'm sure this justifies why we have selected this topic to discuss. Now, we all know, we have heard this right from our school days, that prevention is better than cure. But then there is no cure for a completed suicide. All we are left with as a society is prevention. So let us just talk about what we can do to prevent suicide. Now, before going to prevention, we need to clarify certain things. Now, in our society, in an Indian society, because of a rampant blind faith and lot of misconceptions, there are so many myths about any psychological issue. Talk about depression, talk about psychosis, okay, talk about any anxiety disorders. We have ample of misconceptions about this simple mental issues. Okay, so let us just go through certain myths that we know about suicide. First myth is that people usually say that people who talk about suicide won't really do it. ये सिर्फ बोलते कुछ करेगा नहीं. We often hear these things when in our group, in our families. But the fact is that almost everyone who attempts suicide has given some clue or warning. So it is important to not ignore such indirect references. Sometimes these people who are depressed, who are going through some psychological issues might just say, "You'll be sorry when I'm gone." या तेरे next birthday पे शायद मैं नहीं रहूंगा. And then we just joke around. But then these things have to be taken seriously. Every suicidal threat, every suicidal thought has to be taken seriously. No matter how casually or jokingly said, it might indicate some serious suicidal feelings. Next myth is about people saying anyone who tries to kill themselves must be crazy. यार ये तो पागल है, कुछ भी बोलता है ना? So most suicidal people are not psychotic. They are not crazy. They are not insane. In fact, they are upset. They have just lost someone probably. They are depressed. They are going through some psychological issues or some despair, some distress, some emotional pain, which might not necessarily be signs of mental illness. But then they want to vent it out. We need to hear them out. People say if someone is determined to kill themselves, nothing is going to stop them. यार मैं कितना भी करूँ तो क्या कर सकता हूँ? अगर इसको करना है तो कर ही देगा, है ना? This is how people think. But no. Even a very severely depressed person has mixed feelings about death. He keeps on thinking about it. The thoughts fluctuate between wanting to live and wanting to die. That's the conflict. That's the confusion that they go through. Rather than wanting death, they just want the pain to stop. the impulse to end their life does not last forever, and we need to tap them at that point. Then another myth says people who die by suicide are people who were unwilling to seek help. Again, it's a myth. Many
Sir,
people, yeah,
sir, excuse me, sir. I'm sorry. The
yeah,
slides are not changing.
okay,
Yeah, the presentation mode, I guess, is not on. The slides are not changing. Right now, yes, right now we see the slides. Earlier, we were seeing the numbers only.
okay, fine.
Yeah.
So
I'm so
right
sorry.
now you are able to see the changes, right?
Yeah, now we can see the myth slide.
Okay. But
Thank you.
the audio was on, right? So you were
The
listening to the.
audio, yes, audio was very clear.
Okay. I'll
It
just
was just
quickly
the
go
slide.
through the myths again. I will just quickly go through the myths again. Okay, so I was talking about a lot of misconception in our society regarding psychological issues. So when we are talking about suicide, obviously people do not find it comfortable to talk about this topic. So it's bound to have a lot of myths and misconceptions. So the first myth that I was talking about was about people saying that people who talk about suicide won't really do it. कि ये सिर्फ बोलता रहता है, करेगा तो नहीं. But ऐसा नहीं होता है. Okay, people who express anything regarding suicide, any feelings that are related to suicide have to be taken seriously, even if you find it as a joke or a casual statement. The second myth I talked about was about people saying that anyone who tries to kill themselves must be crazy. तो कुछ कोई पागल नहीं होता, कोई crazy नहीं होता when they talk about ending their lives. Basically, these people who are going through a troublesome issue in their life, they are upset, they might be grief stricken, they might have lost someone in their family, right? They might be depressed or in some despair or in extreme pain, but they might not be necessarily signs of any mental illness, but then these expressions are very important. Third was about if someone is determined to kill themselves, nothing is going to stop them. कि ये अगर इसने ठान ही लिया तो ये पक्का सुसाइड करके ही लेगा. It is not that way. Even a very severely depressed person has mixed feelings. They are always in a conflict between wanting to live and wanting to die. Now we need to tap them between this confusion and bring them back. The second last one was about people who die by suicide are people who were unwilling to seek help. So people always keep on blaming these people that probably उसने कभी help लिया ही नहीं, खुद से लेना ही नहीं चाहता था या कुछ medical help लेने की कोशिश ही नहीं की. But most of the time it is not the case. Many people try to get help before attempting suicide. In fact, studies indicate that more than 50% of suicide victims had sought medical help in the 6 months prior to the death. That is what research is saying. So these are the common misconceptions around suicide. And the last one is about people say talking about suicide may give someone the idea. ये बहुत बार मैंने सुना है कि even I was there was one comment passed in one of my school seminars by one of the teachers कि सर ये सब आप बच्चों के सामने बोलते हो तो उनको ये सब सोचते तो नहीं बैठेंगे. Even parents used to talk about this in my sessions, but then it is a myth, it is a misconception that the more you talk about suicide, the more you are instilling any idea into that person. It is not that way. In fact, you don't give someone suicidal ideas by talking about suicide. Rather, the opposite is true. Talking openly and honestly about suicidal thoughts and feelings can in fact save a life. You prepare a window. You prepare a window to that person who is just thinking about ending their lives and probably getting very much confused about it. And you suddenly by talking, you open a window so that he or she starts venting about it and try to find out a solution through it. So these are the common misconceptions that I needed to clarify before I move on to the next topic. That is the primary topic about prevention. Now, before I just keep talking about my views, I want you all to tell me what do you think if I give you a scenario, if there is a person known to you, a close one, a loved one, a family member, a friend, who has just expressed something very negative that he wants just to end his life. He doesn't feel any purpose to live his life. What will be your reaction? Can someone just express what will you do? Let us keep this interactive a bit.
Show him a Sandeep Mysore video.
Yes. Did someone say something?
Show him some motivational videos or anything.
Okay. So what are you intending to do when a person is actually, expressed कि मुझे अभी मरना है, मुझे बस जीने का कोई इच्छा ही नहीं है. Do you think a motivational video can just change that thought?
Consult a psychologist and a psychiatrist.
Yes. Okay. That can work. I'll come to that. Okay. Aisha says, I will ask him why he or she got that feeling doing that. So you want to ask certain questions to that person. Good. Okay. Any other input from you all? Someone has just told you that he or she doesn't want to live, and he is a very dear person to you. Just imagine, क्या करोगे, क्या बोलोगे उसको? Try to find the root cause effect. Okay. So how do you go to this root cause? There has to be a conversation. That is what I want to know. What must be the basis of this conversation according to you? Yes, please. You can, of course. Hmm. बरोबर. ओके. फार छान सर. म्हणजे तुम्ही अगदीच ओव्हरव्ह्यू दिलेलाच आहे की माझ्या पुढच्या स्लाइड्सचा. तर एक तर आहे की जसं सरांनी सांगितलं की आता आपण त्यांना एक विंडो एक प्रकारे ओपन करून देणं की त्यांचे विचार बाहेर काढण्यासाठी, सो दॅट त्याच्यावर आपण काहीतरी काम करू शकू. भक्ती मॅडम हॅज जस्ट सेड की लिसन टू हिज स्टोरी. Of course, the story is very important in this case. When you want to understand, जब आपको समझना है कि ये इंसान इतना नेगेटिव सोच कैसे सकता है कि अपना लाइफ को एंड करना चाह रहा है, तो उसके पीछे कुछ ना कुछ रीजंस रहेगा. वो रीजन समझना बहुत जरूरी है. और उसका मतलब ये नहीं कि उसको इमीडिएटली सॉल्यूशन देना. आई विल कम टू दैट पार्ट. बट ये लिसनिंग जो वर्ड है, ये लिसन और टू हियर इट आउट इज वेरी इंपॉर्टेंट. सो यस, सो आई जस्ट मूव ऑन विथ माय नेक्स्ट स्लाइड्स. So when we are talking about prevention, everybody knows this gentleman, okay, Chester Bennington. He died by suicide by hanging in 2017. He was the lead singer of the famous band called Linkin Park, right? So this is his photo just a few days ago, before he died due to suicide. His wife has tweeted, "This was days before my husband took his own life. Suicidal thoughts were there, but you had never known." So by looking at a person, you might not be immediately recognize कि ये person को कुछ तो suicide thoughts आ रहा है. You cannot notice any signs of sadness or grief or any signs of desperation on this person's face. But then yes, just 2 or 3 days later, he had died due to suicide. So even after this mask, we need to still try to understand what are the other warning signs. Face may not show you those warning signs, but the thoughts or probably the behavior of the person might show. So understanding these warning signs becomes our primary step to help that person. So the first thing is talking about suicide. For example, making statements such as "I'm going to kill myself." Right? That is a straightforward thing, that I want to end my life, or "I wish I were dead." Now, most of us probably have this moments where we feel कि अरे यार, this is not the life that I wanted. I wish I was dead. Okay, if this keeps on repeating, okay, if this becomes very consistent, a very consistent thought pattern, then probably it is a very serious thing to be dealt with. Now, people also say, I wish I hadn't been born. This world is not for me, right? So such statements are very indicative towards people who might end up ending their life. Getting the means to take your own life, such as buying a gun or a stockpiling, guns or arms and ammunitions are not a part of our Indian scenario. But then, yes, overdosing. People go to the medical store, they buy the phenyl, they buy sleeping pills. Okay, right now it has become very strict, but still, these things have happened. And withdrawing from social contact and wanting to be left alone. So अचानक कधीतरी असं वाटतं की हा एकदमच गप्प झाला, आता सोशल मीडिया अकाउंट्स बंद झालेत, आपल्यासोबत आता जास्त बसत नाही, फोन केला तर त्याला कॉल्स रिसीव्ह करत नाही किंवा मेसेजेसला रिप्लाय करत नाही. So all these signs are very important. Having mood swings, such as being emotionally high one day and deeply discouraged the next. So mood swings, you see this कि अरे अचानक इतना क्यों चेंज हो रहा है, अचानक इतना क्यों हंस रहा है, इतना कुछ हंसने जैसा था भी नहीं वहां पे, but he is trying to show something which he is not feeling, right? Being preoccupied with death, dying or violence, some thoughts, some he or she tries to read novels or text or articles which are related to death or any violent topic. Feeling trapped or hopeless about a situation. Okay, increasing use of alcohol or drugs. This is very important in this age group, in the youths. Now we all know in our locality also drugs is have become a menace. I've received so many patients who have been subjected to drug addiction, and they have gone into dependence, and we have admitted them. Very young chaps going to schools, even in the schools, school students have come to me. So this is something which can be called as a vicious cycle. You get depressed, you have psychological issues, you tend to increase your addictions, and also addictions can cause mental health issues and depression and suicidal thoughts. So this increasing use of alcohol and drugs, this pattern can also be a warning sign in your loved ones. And of course, a changing normal routine. It's a very disorganized routine. कधी पण उठतो, कधी पण झोपतो, कधी पण जेवतो, skips करतो, right? Meal skips करतो. And so this disorganized routine is also a warning sign which we need to tap on. High risk behavior, people indulging into drug addiction, driving recklessly, this giving away belongings. So suddenly they will come up with certain things which was very dear to them, and they will hand it over to you. And especially in the elderly, they try to make their wills. Okay, they try to wind up their businesses. So these subtle signs we need to be aware about, and we need to investigate. We need to ask them empathetically about what is actually going on in their mind. People say goodbye, people might write notes, people might schedule an email to be delivered later after they have committed the act. Okay, so these things can also act like warning signs, and of course there can be a change in their personality also, and you might see it in their behavior. So these are the warning signs which can help us to at least become alert, try to help them to seek help, and of course listen to their story, as ma'am said. Which are the specific population that we need to be aware about? Someone who has already attempted a suicide in the past. Okay, there is a very highly likely chance that they might do it again. People or youths or young people who have been victims to substance dependence, addictions. Young males are prone, as we had seen in the statistics slides. People who have just lost their dear ones, the bereaved. Okay, especially in the last 1.5 year, we have been seeing families being bereaved, losing their loved ones. So this extended grief can also lead to suicidal thoughts. Migrants are people who have uh, traveled to a different culture, different locality, and they have to adapt to those changing situations, and that might precipitate psychological issues in them, might precipitate frustration, and might precipitate self-harm thoughts also. People who have issues with their sexuality, so alternate sexualities, homosexualities, LGBT communities, these people are also, research has shown that these people have a lot of psychological issues and a lot of suicidal ideations also. And people who have medical illnesses which are chronic and debilitating, they tend to have a lot of depression and anxiety issues, which can also, the spectrum of which can also have suicidal thoughts. So these are the certain specific populations. If you know people falling into this, you should be alert about them. Okay, so now as I had asked you the question, how and what to talk to a person who has just expressed that he wants to end his life, तर तेव्हा आपण काय करावं? Okay, so I have simplified it into only 3 tips. Okay, the first one is to speak up if you are worried. You can't just keep on thinking ki kadi vicharu, kasa vicharu. We have to start that conversation if you are really worried that that person might end up committing a suicide. So if you spot these warning signs that I just talked about, you may wonder if it's a good idea to say anything. तर मनात असा विचार येतो की मी जे बोलेल ते बरोबर बोलेल का, मी जे बोलल्यामुळे कदाचित त्याला अजून काही त्रास झाला तर, तो रागवला तर, त्याला एकदम चिडचिडा झाला तर की मी असं विचारतोय तर. बट read the last sentence. You can't make a person suicidal by showing that you care. Your care is not going to change anything. Your care is not going to change anything in a negative way. In fact, it will only give them a window to start talking or start that conversation which they were waiting for. Okay, so in such situations it's very natural for you to feel uncomfortable, so it's fine to feel uncomfortable to start this conversation. Talking can extremely become difficult at such a point where probably आपल्याला माहितीच नसतं की कुठून सुरू करावं. But if you are unsure whether someone is suicidal, the best way to find out is to ask. Start their story. Ask them what are you thinking right now. So how do you start this conversation? You can start it in a very subtle way. You can just say, I have been feeling concerned about you lately. मला तुझी थोडी काळजी वाटते रे. तू का असा वागतोस, तू का असा विचार करतोस, तुझ्यामध्ये मी थोडासा चेंज पाहिलाय, तो आपण बोलूया का त्याबद्दल जरा. So recently I have noticed some differences in you and wondered how you are doing. I just wanted to check on you. I wanted to check in with you because you haven't seemed yourself lately. तर अगदी सौम्य रीतीने, अगदी शांतप्रमाणे आपण असंच बोलू शकतो की मला थोडी तुझी काळजी वाटते, म्हणून मला तुला थोडंसं विचारायचं की हल्ली काय नेगेटिव्ह विचार येतात आहे का तुझ्या मनामध्ये. When did you begin feeling like this? So once he or she starts talking, you can ask about the time. Since when he or she is feeling this way? Did something happen to make you start feeling this way? काही झालं का असं की कोणी काय बोललं तुला, किंवा तुझ्या मनामध्ये काही असं, तुझ्या जीवनामध्ये असा काही अडथळा आला किंवा काही प्रॉब्लेम झाले त्याच्यामुळे तुला असा त्रास होतोय का? हाऊ कॅन आय बेस्ट सपोर्ट यू राईट नाव? मी कसं तुला हेल्प करू शकतो? मी काय करू शकतो की तुझा हा विचार आता मी कमी करू शकतो? हॅव यू थॉट अबाउट गेटिंग हेल्प? अँड लास्टली, as someone said, ki whenever you feel ki you have your limits, you cannot help beyond a certain point, try to motivate the person to seek help. So you can start talking about seeking help through a mental health professional. What you can say that helps? You can say, you are not alone in this, I am here for you. राईट? तू एकटा नाहीयेस. ठीक आहे, तुला असा निगेटिव्ह विचार येतोय, तो येऊ दे, तो तुझा विचार आहे, आपण त्याबद्दल काहीतरी करूया. आणि तुला ह्याच्यामध्ये एकटेपणा समजून घेण्याची काहीही गरज नाही, कारण मी आहे तुझ्यासोबत. यू मे नॉट बिलीव्ह इट नाव, बट द वे यू आर फिलिंग विल चेंज. तुला आता या क्षणाला कदाचित असं बिलीव्ह होत नसेल, विश्वास बसत नसेल, पण नक्की हा विचार जाणार आहे नंतर. आपण त्यावर नक्की वर्क करूया. I may not be able to understand exactly how you feel, but I care about you and I want to help. Normally काय होतं की कोणी जेव्हा सुसाईड बद्दल बोलतं की मला जगायचं नाही, तर नॉर्मली आपलं रिॲक्शन कसं असतं, किंवा कधी कोण म्हणतं की मला वाईट वाटते, मला फार नैराश्य वाटते, तर आपण नेहमी म्हणतो येस येस आय कॅन अंडरस्टँड, मला माहिती आहे, आय हॅव गॉन थ्रू दिस. सो ट्राय टू अवॉइड दिस सेंटेन्सेस वेअर यू आर ट्राइंग टू शो or trying to judge that person ki whatever you have felt, even I have felt that way. That is not what the person wants to hear. त्यांना ते नाही ऐकायचंय की तुम्हाला पण माहिती आहे किंवा तुम्हाला पण तेच फील होतंय किंवा तुम्ही सुद्धा असं फील केलेलं आहे. त्यांना फक्त त्यांची स्वतःची जे इश्यूज आहेत ते त्यांना कोणाला तरी बोलायचंय, कोणीतरी ऐकून घ्यावं ही त्यांची इच्छा असते. त्यामुळे तसं बोलण्यापेक्षा आपण हे बोलावं की आय मे नॉट टू अंडरस्टँड, की मला कदाचित तुझा प्रॉब्लेम समजू नाही शकणार, पण मला एवढं माहिती आहे की मला तुझी काळजी आहे, मी तुझं सगळं काय ऐकून घेणार आणि मला एवढं माहिती आहे की मला तुला मदत करायची. When you want to give up, tell yourself you will hold off for just one more day, hour, minute, whatever you can manage. आपण एक दिवस पुढे जाऊया, एकदम पुढचा विचार नको करूया. आजचा दिवस, आता तुला जो त्रास होतोय तो आपण आज डील करूया आणि मग उद्याच्या दिवसाबद्दल आपण उद्या विचार करूया. So you give that person patience, you give that person some time, you give that person some hope. So try to be just yourself. Don't try to act out of your personality. Let the person know you care, that they are not alone. Finding the right words may not be important as much as it is your concern. तुमची काळजी त्या व्यक्तीसाठी महत्वाची आहे. तुम्ही काय बोलणार आहात, कसं त्याला सॉल्युशन देणार आहात, हे त्या क्षणासाठी महत्वाचं नसतं. Listen. Madam said, listen to the story. That is very important. Let your friend or loved one vent and unload their feelings. And don't interrupt. Just let them talk. Let them vent out. Let them cry. Let them get angry. Okay, let them express as much as they can. No matter how negative the conversation seems, the fact that it is taking place is a positive sign. Now, I remember one conversation where I had heard somewhere where a student Vati, she just expressed to her teacher about her negative feelings. Okay, she talked about all the negative things that she was going through and all the negative issues that she had in her life. And then she said that while I was talking to the teacher, she started feeling guilty. She started feeling overwhelmed that probably I am just passing on the burden to that teacher, and that teacher is just getting burdened because of my negative emotions. And then something changed for her by how the teacher reacted. The teacher said, anytime it is better that I get burdened by your thoughts to listen to that. की त्या टीचरना हे ह्या गोष्टीचा त्रास होत नव्हता की त्या सगळ्या नेगेटिव्ह इमोशन्स ती स्वतः ऐकत होती, पण she would have any time listened to that rather than losing her. So that was very important. The listening part becomes very important. Try to be as sympathetic and non-judgmental as possible. These people who have the most negative thought of their life, of ending their life, do not want to be judged. That's the fear. That's why they do not open up. त्यांना बोलण्याची जी हिम्मत होत नाही, ते याच भीतीने होते की कदाचित आता मला माझ्याबद्दल हा कसा विचार करेल, की मी असं कसं आहे, मी असं कसं करू शकतो. That is the judgment that they fear. So let us try to be non-judgmental whenever we listen to these thoughts, and of course offer hope. Hope is very important in such a negative scenario, and take the person seriously. So these are the do's that you do when you talk to a person who has expressed suicidal feelings. There are also certain don'ts. Okay, what you should not do during this conversation. Do not argue with the suicidal person. Avoid saying things like, you have so much to live for. अरे तुझ्या लाईफ मध्ये एवढं काय आहे, तू काय हे असा विचार करतो. Your suicide will hurt your family. तू असा विचार करून तुझ्या फॅमिलीचं नाव खराब करणार रे. Or just snap out of it. काय असा फालतू विचार करतोय, हे असं काही विचार करायचा नाही. So don't use these arguments whenever you have this conversation, because that might act like a trigger. That might pull that person even more down. Don't act shocked. Yes, I completely understand that whenever out of the blue, if you come across this thought by your loved one, you might feel negative emotion inside yourself. You might feel shocked, but don't show it to that person. Don't start lecturing about the value of life, की लाईफ मध्ये हे आहे, लाईफ मध्ये ते आहे, तू असं कसं काय विचार करू शकतोस, लाईफ मध्ये तू तरुण आहेस, पूर्ण आयुष्य पडलेलं आहे अजून. So don't use such words during that conversation, and don't argue that suicide is wrong. Obviously the person doesn't want to end his life. He's being confused, but there are so many emotions, so many thoughts that is pushing him towards that end. At that time he doesn't want any lecture. He doesn't want any kind of a motivational video at that point of time. Now, don't promise confidentiality. This is something that you should not keep secrets about. Even though you said ki okay fine तुम्हाला सांग, मी कोणाला सांगणार नाही, but probably you might have to break your word, because depending upon the severity, of course, you know that the person has expressed completely, and you feel that the intent is very high. The person is definitely planning something. There is no need to keep any kind of a confidentiality in such a scenario. Don't worry about how the person will think about you later. Probably there will not be a later moment. So let us not promise any kind of a secrecy or confidentiality to a person who is expressing a suicidal thought. It is always better to inform the family or the authorities immediately. Don't offer ways to fix your loved one problem. Like I said, when they are expressing it, they do not want your solutions. The solutions may not be correct. The solutions may not give any immediate relief. They just want to be listened. That's all. Don't blame yourself. Now, even after listening, you can't fix someone else's depression. So your friend or loved one's happiness or lack thereof is not your responsibility. You will have your limits. I will come to that. When you listen to this conversation, you will feel a limit beyond which probably you may not be able to help. The severity is very high, and at that time you might need someone else to help you. We'll come to that later. So that was to initiate a conversation and taking it ahead. Then, of course, now you know everything has been done. You know that the person is suicidal. Now, the next step is to respond quickly. Now, this is an emergency. You have to uh, understand that this is an emergency situation. So you need to understand the plan. You keep talking with that person. You buy that time. The time is very important. You start asking about his plan. You start asking about what are the means that he or she is trying to use to execute that plan. You ask when are you planning to do this, and what is the intention. So all this you gather as much as information as you can, because that is going to help you to help him or her later. Now, just a simple slide about how to grade the levels of this risk, of a suicide risk. So basically it's a very technical thing, but then which is used medically, but then you also should know about this. So there are 4 levels: low, moderate, high, and severe. Low is as good as any death wish. So some suicidal thoughts, you just want to end your life, but then there is no plan. It is just a kind of an impulsive thought. The person says that they won't attempt suicide. Moderate is where there are suicidal thoughts, and there is a kind of a vague plan, not a very technical plan, but then they are saying, okay, मी जाईल काहीतरी औषध घेईल किंवा मी रस्त्यावर जाईल. Okay, so there is a very vague plan about this, but then they again say की नाही कदाचित मी नाही करणार. They won't attempt suicide. High level of suicide risk comes where there are suicidal thoughts and there is a specific plan. Okay, they have calculated a plan how they want to execute it, and that is highly lethal. Though they are saying that they won't attempt suicide, but they have a plan ready. And the most severe is where where the plan is also ready, and the person says that they also express that they are definitely going to attempt that suicide. So if a suicide attempt seems imminent, you need to take help. Now your limits have probably been reached. You cannot help that person beyond your limits. Now you need to take help for yourself. So you have to inform the family, you have to inform the police, or you have to inform the psychiatrist or the psychologist who is taking care of that person. Try to remove any lethal objects such as poisons, drugs, guns, knives, if they are in the vicinity. And if you are the first contact with that person, please do not leave that person alone till you are sure that there is the help being provided immediately. So do not under any circumstances leave a suicidal person alone. And lastly, how to offer help and support. So if a friend or family member is suicidal, the best way to help is by offering an empathetic and listening ear. That is the whole principle of this slide, to listen. Let your loved one know that they are not alone and that you care. Don't take responsibility, however, for healing your loved one. Let the professionals do it. You can offer support, but you can't make a suicidal person get better. This needs to be understood. You cannot correct suicide. Okay, you cannot correct suicidal. You can buy time. You can show empathy. You can just, help them motivate to take help, but you cannot correct a suicidal thought immediately. So they have to make a personal commitment as well to recovery. And remember, it takes a lot of courage to help someone. Okay, when I'm talking to you as a help, it takes a lot of courage. And witnessing a loved one dealing with thoughts will end up with a lot of difficult and negative emotions within yourself as well. So as you're helping a suicidal person, don't forget to take care of yourself as well. You have just come out of an emergency situation. You might feel overwhelmed. You might feel shocked. You might feel sad. Okay, you might feel broken. You need to take care of your emotions as well. Talk about your feelings as well. Find a person, find a family member, find a counselor, vent it out for yourself as well, and get the support of your own. So simple. Whenever you have to help a suicidal person, try to the best way to do is to get professional help. Seek out for psychiatrists, seek out for psychologists, seek out for counselors. Any mental health professional would do to help the person deal with those negative thoughts. Once the treatment is started, If it is your friend or a loved one, try to motivate him to carry on with the treatment. Try to follow up with them. Ask them, how was the session? Or what did you talk about? How did you feel after the session? So keep a check on this person's treatment plan as well. Try to be proactive. Okay, don't wait for the person to inform you everything. You can just keep a regular check-in. You can drop by his or her home. You can call him. You can simply drop a message of how are you doing, right? Rather than waiting for that person to reach out to you. And of course, then there are this non-medical ways in which we can go: positive lifestyle changes, exercises, making a safety plan. Safety plan is something which is a kind of a hotline where immediately after a person has a suicidal negative thought, there has to be a kind of a emergency plan ready. Okay, so you can help the person develop a set of steps. Okay, it should identify any triggers that may lead to suicidal crisis. So let us take example of drugs. So if a person has just come out of an addiction, you can help him stay away from it, because those drugs were acting as a trigger to kind of increase his mental health issues, increase his depression, increase his anxiety, and that is why he used to go to those suicidal thoughts again and again. So you can help him stay away from those drugs. He can from alcohol. If there are any relationship issues, you can seek counseling. You can seek couple counseling. You can seek relationship counseling and try to solve those matters. Try to change the perspective towards looking at that relationship. Okay, and of course, then the doctors are there, the psychiatrist is there, the hospitals are there to help them. Remove potential means of suicide, we have already talked about it. And as over the long haul, you need to keep checking on these triggers. You need to keep checking on the recovery of this person that you love. Okay, so this is about how to prevent a suicidal thought, or because that is the only thing that we as a society have, the preventive measures to help people come out of a suicidal thought. Now, just to simplify, the next few slides I'll be just running through. This is more from a medical point of view, but I want to share this knowledge, this medical knowledge to you, regarding what happens beyond your part, where you have talked to the person, you have listened to them, and now you have motivated them to seek help through a mental health professional. So you need to know about what happens next. So when we are talking about those levels of prevention medically, the primary level of prevention is basically what we do at the community level, right? So basically imparting, the mental health team, what we do is we impart this mental health education, this positive mental health education in the community by advocating lifestyle modifications, and we do drug awareness seminars. We help them understand a healthy diet routine, regular exercises, good sleep hygiene is very important, right? Or goal settings, and obviously whenever it is necessary, we help them motivate to seek help, seek professional help for their issues. Personally, I have interest in school mental health. As ma'am told, we have done this in Viva College and in Utkarsh School also. Now, I have my own school mental health program in Virar, where I believe that everything should start at the younger age. Uh, when the brain is developing, when emotions are being understood, when life skills are getting formed. So basically, I have this school mental health program called Smile, where it is basically a life skills based program which revolves around self-awareness and how to critically think about issues, how to manage your stress at an early level. Then there are certain parenting seminars where parents are taught to identify these issues with their children and seek help. Teachers are the second parents. I always believe that. So teacher training programs are done, and of course developing positive coping skills to deal with stress and new challenges in life. So these are the school mental health programs that I do. The addiction awareness drives are taken at a community level to make youth understand the adverse effects of substances or drug abuse on mental health. Community awareness programs such as so as to reach out to the society, because such issues cannot be dealt in the four walls of a clinic. We need to go out in the community, we need to talk to the people around, we need to share our views, we need to listen to their views about mental health, and that is where the communication starts. Then comes to the secondary level, that is early diagnosis and treatment. That is what happens when the patient is brought to a clinic or to a counseling room. So we usually do those. We identify the risk factors, the triggers. Where we give special importance to the specific population that I talked about. We understand the warning signs, and then we assess the risk. And then, depending upon the level of institution, we either we start treating the person over there, or we refer that person to a tertiary care. And then, like I said, now I'll just give you an example. If your loved one has just had a road accident and you are there in front of him, he's there in a pool of blood, right? What will you do? Is the straightforward answer is to take him to a hospital, right? You will not sit there and start talking about, अरे यार तूने किस तरह से गाड़ी चलाया, मैंने बोला था ये गाड़ी मत चला, या मैंने बोला था ये रोड पे नहीं जाना चाहिए था तूने. So we do not talk about these topics where we try to advise them कि this should have not been done. So that is why you are facing this accident. That becomes an emergency. We immediately, what we do is to take that person to a hospital, because that is what they require. Suicide is also a suicidal thought is also an emergency. Try to treat it that way. Whenever a person expresses, and if you know that the intent is very high, the person definitely might indulge into some act which might end his life. Treat it as an emergency. Don't just keep on talking to him, or just don't keep on advising him about things that he doesn't want to listen. Treat it as an emergency. Take him to a psychiatrist, take him to a hospital. So what happens once a patient comes to a hospital who is suicidal? So there is something called as an inpatient psychiatry unit. Okay, we now, when in a psychiatry unit, now this is not something that we usually see in televisions, in serials, and in movies. A mental hospital doesn't resemble what is being shown to you in the media. A mental hospital or a psychiatry inpatient unit is completely different. Okay, whenever a person with such a behavior where he tries to harm himself, and there are patients who suffer from mental issues where they also try to harm others, so they have to be treated in a very secured environment, a very safe environment. Now this is what my hospital looks like. This is the ward. Now these are called as ligature and there is resistant rooms. So as you can see, there are no ceiling fans, right? The nursing station has a very unobstructed view, so every patient is being observed. So this observation becomes very necessary. Okay, there are no potential ligature risk points through which a patient can hang themselves. So these are very specific guidelines in which a ward is being designed. Then the doors do not have locks, so a person cannot lock himself or herself. Every bed can be seen from all possible angles and high ceilings without any hooks. So this is very important if you want to secure a person who is very highly intending to end his life. Okay, they need a secure environment. That is why they need hospitalization. Then there is a 1:1 monitoring that happens for this patient in the initial acute phase. There are no sharp instruments or any means of lethality allowed inside the ward or inside the room. Patient is being accompanied by attendant wherever he or she goes, even to the washroom. He is being observed all 24/7. There is a CCTV monitoring that happens for such patients. So the idea of showing you this is what happens in a psychiatry unit is not what you see in a hospital. It is a very observed, very secure, very supervised way in which a person is being treated. And people with suicidal intent need this treatment. So the treatment plan later involves pharmacotherapy, electroconvulsive therapy, then the psychotherapies. There are various modes of psychotherapies that can be used for people having suicidal thoughts. There is something called as a family therapy, because there are certain issues related to the families, and the family roles, the roles of the family needs to be explained to them so as to help these people. And of course, the medical consultation if required. Now, this is something that we can probably talk on a very different note or different day. Electroconvulsive therapy, ECT, which has a stigma of its own, right? We call it as a shock therapy, which is not. It is not. It is called as electroconvulsive therapy. It's a very secure way, one of the best treatments in psychiatry, especially in a emergency where a person is actively suicidal. It dramatically changes the suicidal thoughts. So this is a research-based technique which is being used in a psychiatry unit. And then comes the later part. So we have handled the emergency part. We have brought the patient out of that suicidal, the active suicidal thought. What comes next? Next comes rehabilitation. What do you mean by rehabilitation? Again, giving an example of let us talk about a bone fracture. So whatever I talked about till now was similar to applying a plaster. आपण प्लास्टर लावून घेतलं, ते हाड जोडून घेतलं, त्याच्यानंतर आपण काय करतो ते असतं फिजिओथेरपी. That is similar to psychosocial rehabilitation. So there is a routine that is because, as I said, people who go through negative emotions usually find it very difficult to have a very organized day routine. So there is a day routine in the hospital. Okay, there are various modes, non-medical modes such as prayers and yoga, meditation. Okay, there are individual therapy sessions, there are group therapy sessions, there are games, there is a TV time, there are recreational activities. These people who have suicidal thoughts, who have gone through negative emotions, need this ventilation, need this secure, loving, empathetic environment to come out and go back to their own self. So this is the rehabilitation that happens in a psychiatry unit. Music therapy, art therapy, group therapies. So yeah, so this is a group therapy that happens in our unit. So this is where I end about the presentation with the and this is the last slide where even the staff at the psychiatry hospital is being regularly taught, being taken seminar, that seminars are taken for them so that they learn about such incidents and they can handle those emergencies very well. So this is where I end, and I would conclude with this take-home message that again, everybody needs to understand that suicide is an emergency. It is as important as any other physical emergency. So establishment of a rapport, rapidly screening the presence of any specific mental disorders leading to this suicidal thought, identifying those warning signs that I talked about, and immediately referring these people to a mental health professional, a psychiatrist, a psychologist, or a counselor, or a psychiatric hospital is necessary. And as I have said, there is no cure. But then, yes, every suicide can be prevented. Every suicide can be prevented. Let's achieve a zero suicide target, however time it takes, but let us start doing it together. Thank you very much.
Every suicide can be prevented. A very powerful message, Dr. Kirti. This is, I really appreciate you coming here, Dr. Kirti. Otherwise, we wouldn't have known many of the aspects that you have covered in this session, especially the inside of the ward, what happens, how are they taken care. Some such sort of information is, we do not get a chance to see this. You actually have got us a virtual tour of the hospital where patients with suicide attempts are treated and how they have been helped with. Again, also the way you crack the myths, the way you give us the information about what should be done and what should not be done. This is something we really, really needed. We do not understand that we have lost the person unless we've actually lost the person. And then, as you said correctly, there is no cure. What we have is only the prevention. Thank you very much, Dr. Kirti, for coming here. Should we open the question and answer session if you are okay with it?
Yes, of course, fine. Of course.
Students and all the participants, in case if you have any questions, any query, you can either type it in the chat box or you can unmute yourself and speak. We will wait for questions now. So we have a question.
Yeah.
From Avinash Sunavani, sir. I have one recent case of suicide of friend. How we can support his family?
Okay. So as I have mentioned in the slide itself, that family becomes very important, because that, most of the time family is the first contact with this person, right? Now when we are talking about, now I'm not sure about the case whether the suicide was a complete attempt or a just an incomplete attempt, but whichever ways, the family gets disturbed. The family gets disturbed because they feel inadequacy within themselves. They have their own issues because they have seen that one of them have gone through such a, okay, so that is very unfortunate. So yeah, so in such a case, of course, grief counseling can be done for a family as a unit. Now, we as mental health professionals, as Rashmi madam would know, we have our own ways in which the counseling mode can take in a session. We can ask them to follow up with a mental health professional, take regular sessions, weekly sessions at least, to let them vent out what they have gone through over that period. So I would the first answer to that is to please seek help, professional help, because this is something that needs to be done immediately. Like I said, triggers, now since it is a family issue, family history becomes very important. Now we have seen the family has seen a negative incident, and hence they might have uh, a few members in their family who might go through similar issues again. Okay, they might because of the inadequacy, because of the guilt, they might have their grief might get complicated, their grief might turn into depression. And as we all know that the most common cause of a suicide is depressive disorders, so we need to tap them. We need to identify any other psychological issue that might have come up due to that suicide in those families. So talking to that family becomes very important. Calling them for sessions becomes very important.
Thank you, sir.
सर एक डाउट है
हाँ बोलो सर से पूछ सकते हो डायरेक्टली.
सर मेरा एंटी डिप्रेशन पिल्स मेडिसिन चल रहा है तो सर कम कैसे होगा वो मतलब
Okay, if I'm not, I'm talking to Harsh, right?
यस सर
Yeah. So, hello Harsh, and I really appreciate you opening up about your treatment. So, देखो कैसा है हर्ष कि एंटी डिप्रेशन जो होते हैं वो पिल्स, अभी तुम्हारा जो भी साइकेट्रिस्ट आपसे जो बात करे या जो आपसे या आपका ट्रीटमेंट का जो केयर कर रहे हैं, नाउ वी नीड टू अंडरस्टैंड कि वो कौन से लेवल पे आपका ट्रीटमेंट चल रहा है. वी नीड टू अंडरस्टैंड कि वो रिकवरी तुम्हारा कितना चल रहा है. See, it is again a myth. Thank you for pointing it out. Now, it is again a myth that psychiatric medications एक बार चालू किया मतलब वो लाइफ लॉन्ग लेने ही पड़ेंगे, या दे आर हैबिट फॉर्मिंग स्लीपिंग पिल्स होते हैं. ऐसा कुछ नहीं है. रिसर्च हो चुका है, न्यूअर मॉलिक्यूल्स आ चुके हैं जो जिसकी वजह से आदतें नहीं लगती है. So my simple principle to my patients is that if you are very regular with your treatment, if you visit the psychiatrist whenever he or she calls you, ठीक है, मेडिसिन में बहुत सारे चेंजेस करने होते हैं, डोजेस में बहुत सारे चेंजेस करने होते हैं, स्टेबलाइजेशन एक फेज आता है.
जैसे योगा और मैं योगा मेडिटेशन भी बहुत ट्राई करता हूँ लेकिन उससे फर्क नहीं पड़ा मुझे.
ओके, तो देखो कहने का मतलब यह है हर्ष की कोई भी बीमारी का दो पहलू होते हैं. एग्जाम्पल मैं सिंपल वैसे ही देता हूँ, जैसे मैंने फ्रैक्चर का एग्जाम्पल दिया कि अगर तुम्हारा हड्डी टूटा होता तो हम फिजियोथेरेपी पे नहीं भागते, हम पहले प्लास्टर कर लेते हैं. बट वो प्लास्टर भी एक दिन निकल जाता है, लाइफ लॉन्ग हम वो प्लास्टर रखते नहीं है, राइट? तो मेडिसिन का भी एक ड्यूरेशन होता है. एक ड्यूरेशन अगर हम अच्छी तरह से कंप्लीट करें तो वो पक्का उसको बंद कर सकते हैं, पक्का उसको कम कर सकते हैं. लेकिन अगर हम इरेग्युलर रहे या तुम्हारी जो डिप्रेशन का जो साइंस होते हैं, जो सिम्टम्स होते हैं, वो थोड़े सीवियर रहे तो शायद कोर्स थोड़ा सा बढ़ाना भी पड़े. तो वो इंडिविजुअल पे होता है, वो इंडिविजुअल इश्यूज पे होते हैं. एक पर्टिकुलर प्रोटोकॉल नहीं फॉलो किया रहता है. इन योर केस इफ योर साइकेट्रिस्ट फील्स कि यस अब काफी स्टेबिलिटी आ चुकी है, नाउ वी कैन टेपर ऑफ द डोजेस, ही और शी विल डेफिनेटली ट्राई डूइंग दैट. जब आप योगा और मेडिटेशन की बातें करते हैं वो भी उतने ही इंपॉर्टेंट होती है. लाइफस्टाइल मॉडिफिकेशंस की मैंने बात की. जब हम ब्रेन के बारे में बात करें या माइंड के बारे में बात करें तो उसमें दो पहलू होते हैं, जैसे मैंने बोला. एक होता है मेडिकल बायोलॉजिकल इशू, जो आपका मेडिसिन आपका ख्याल रख रहा है. तो मेडिसिन की वजह से आपकी जो बायोलॉजिकल जो केमिस्ट्री जो डिस्टर्ब है वो लेवल पे लाने के लिए हेल्प कर रही है. एट द सेम टाइम जो बाकी जो लाइफस्टाइल मॉडिफिकेशंस होते हैं कि ऑर्गेनाइज रहना, एक्सरसाइज करना, डाइट अच्छी तरह से करना, एक रिलैक्सेशन चीजें करना, काउंसलिंग सेशंस अटेंड करना. साइकोथेरेपी में बहुत सारे अपने थॉट मॉड्यूलेशन टेक्निक्स होते हैं कि हम पर्सपेक्टिव्स कैसे चेंज करें अपने लाइफ के सिचुएशंस का, तो वो समझ के उसको इम्प्लीमेंट करना अपने लाइफ में वो उतना ही जरूरी होता है। अगर हम ये सब साथ में करें, रेगुलरली करें, तो ऑफ कोर्स मेडिसिन का एक कोर्स खत्म होने के बाद वो बंद किया जा सकता है।
थैंक यू सर बताने के लिए।
Most welcome.
Sir, we have one input in the chat box. Do you want me to read it?
Yeah, sure, ma'am.
How you all professionals, doctor, are taking care of yourself related to negativity? Because if you're always dealing with negativity.
So that's a wonderful question. Now, when you have written over this, dealing with negativity. So for us, we have been trained that way. Okay, so like I said, there is something called as a coping. Now we as individuals also face this negative emotions day in and out, right? We have this patients coming with depression, with suicidal thoughts. We have people coming with addictions. They are violent. We have to pacify them. We have to control them, and it is mostly it is a medical kind of a control. Okay, so yes, it becomes stressful. It becomes very overwhelming at times, and this is where, see, ultimately we are humans, right? So like I always answer to this question in a different way. Ki, a cardiologist, a heart specialist can also get a heart attack, right? So even a psychiatrist, a psychologist, a mental health professional will also feel stressed at some point of time, because we will have our own limits. Now it is very important to be self-aware. So this is what we try to do on a regular basis. We try to be aware about our limits. We know how we cope up. We know beyond this point probably I may not be able to help. And being honest about this is very important to your client, to your patient. Okay, fine, see, this is where I have reached my limit. This is where I might not be able to help further, so let us take your opinion about taking some other doctor's help or some other counselor's help. Let me just discuss it with her, right? So this also opens up the window even further. Yes, the doctor or the counselor is genuinely trying to help me. Okay, so yes, all those things that I have advised you, I have to practice it myself also. Having an organized routine, having a good sleep hygiene, having doing yoga, doing meditation, doing relaxation techniques, all these are very important. We try to do it very often, regularly.
Great. Thank you. That was very nice. Here we have Deva Upadhyay. He has written something.
Yes.
I will read it.
Sure.
It's a little lengthy, but I will try to keep up. Awesome, speechless. Whatever you said is helpful for the one who's dealing with a person who wants to commit suicide or thinks of doing it. But not really any person wants to end up his or her life in seconds.
Correct.
They just have a myth with them that ending up their lives is the best solution currently they have with them. And as you said, give empathy, but don't keep it secret. Don't keep the talks with you. I don't know why, but maybe I think that this won't work out. Believe that if a person tells or share his feeling, his thoughts with you, whether it's suicide thoughts or something else, he or she believes that the talks will be with you just because there is something which is called trust. Though you are a professional, not me, then too, if really a person wants to end up his or her life, he will. And nothing can stop him after doing it, neither the talk nor the empathy, until it's really worth. So at last, if you are hearing something like, I am going to end up my life tonight, then you are capable of preventing it. Depends upon the talks, the way. And lastly, I want to thank you for what you have shared with all of us today.
That was a wonderful input, a wonderful unbiased input, I would say. Yes, there are moments where we see. I'll give you an example about my own clinical practice. Okay, like if I'm a doctor and if I have my client expressing a suicidal thought and he has not come along with anyone, okay, yes, but then he has come here to vent it out. He has expressed that yes, I have a plan. I have written my suicidal note. It is at home, and right from after going from this, and this has happened. This is not something that I'm making it up. That right from as soon as I leave your clinic, probably I may not reach home. And I've already like put a suicidal note in my diary in the bedroom on the bed. below the pillow. So this is what has happened. So now with this, yes, I give them the time, I try to buy time, but then buying time is not the only thing that I can do, because there is no one along with him right now. So in such a case, I need to break that confidentiality. In our psychiatry or mental health principles, there are two important moments where we can break this confidentiality: when the person is completely planning to harm himself or others. These are the two scenarios where probably the confidentiality issue might, you know, we can work upon it later. Because right now, more important for me is to help that person, give him a secure environment, and that probably I'm alone may not be able to do. So once the patient comes out of those thoughts, I am definitely going to help them, help him or her to handle it later after it comes again and again. But at that point of time, it is an emergency. I cannot think about anything else but to seek to try to gather as much as help as possible to secure that life. Because I may not see here, probably there are certain laws in which I might even have to inform the police authorities. So that has to be done, because we as a society are responsible. I always talk about this sentence where every time we hear about a suicide, it is not just one person who is responsible for it. We collectively as a society are responsible for it. May it be the teachers, the parents, the family, the friends, the psychiatrists, the counselors, everyone are failing because someone, sometime in their life has given a clue, a hint that they need help. Like you said, it is not within seconds. They have been giving these hints many times, but probably that was just taken for granted. We were just joking around, or we were just probably just advising them, giving them lectures of values of life. And that was the point where we could have brought them back by motivating them to seek help. But then probably the time has gone. They have reached that stage where probably, as you said, that the only solution, the best solution, unfortunately that is the word, the best solution that they feel is to just end their life, and just that's the solution for them. So yes, that is, I hope I have answered your query. So it does become difficult at times, yes, I acknowledge that.
Correct. I hope Deva has got the answer of his questions, and the way he has written his feelings so much in detail. I'm sure, sir, you will have an intern to expect now. Do we have any more questions? Yes, there is one question. Once suicidal thoughts occur, can they come after some days, some months? How can we motivate them to take the help of the psychology expert? Most of the people.
Okay. So for the answer for the first question is yes. So see, suicide or any mental, now this is a generalized statement that I always explain whenever I talk about any mental health disorder. Okay, we call it as mental, but it is basically physical. Okay, when we are having a suicidal thought, where does that thought comes out? It comes from our brain. Now, the brain is a part of your body, right? And I talked about the chemistry. I will not go into the details of it, but then there is a neurochemistry, there is a chemistry, a recipe of your brain that helps you to have good positive thoughts. Okay, this recipe is determined by a lot of chemicals like serotonin, dopamine, norepinephrine. So these all need to be in equilibrium. Now, similarly, whenever there is a dip in the serotonin levels, you have these negative thoughts. So any trigger, any illnesses, any life situations that dips the serotonin level might trigger suicidal thoughts or any depressive thoughts in you. So again, giving an example of a fracture, की आता हात जोडलाय, प्लास्टर मस्त ते बेस्ट ऑर्थोपेडिशन पासून केलंय, बाहेरून काहीच दिसत नाहीये, पण जर तुम्ही तसेच निष्काळजीपणा केला, हात तुटणारच आहे परत. Similarly, the mental fracture can also happen again if you do not learn from it, if you do not carry forward the treatment protocol that the psychiatrist or the counselor has told you. So obviously, your coping mechanisms will fall short, and obviously you will definitely get those negative thoughts again. So that is the answer to the first question, and how we can motivate them to take help. Yes. So the whole idea about this seminar was to create awareness, right? So creating awareness about these issues and keeping on talking about those things is very important, because unless and until the person knows the gravity of taking help, they might not find it very important, right? सो अगेन एक्झाम्पल की आता ताप आलाय, आपल्याला काळजी असते, आपण त्यांना सांगतो की चला डॉक्टरकडे जाऊन या, आपण तपास करून तर बघूया, जर काही नसेल तर कदाचित आपल्याला काही करायची गरज नाही. सिमिलरली, येस, देर इज अ स्टिग्मा टू गो टू अ सायकियाट्रिस्ट or a psychologist, so that stigma will always be there, though it is decreasing. But yes, we should keep trying. We can explain them, let us just go for one visit, later on it is our responsibility to how to talk to that person and convince him. But then the first contact to bring that person to the clinic or to the counseling room becomes very important. So yes, the family's role becomes very important in such a case.
Yes, Aisha. Aisha, you want to speak something? You can unmute yourself.
Yes, ma'am. Thank you. I have a question. We can take it like a psychology or a criminology perspective. From the criminology perspective, there are cases of suicidal which are actually hyper diagnostic. Sorry, I'm not getting the exact word. Like लोग दूसरे लोग अपने को करते दिमाग में डालते कि suicide is the best way you can end your life. So as in the psychology it says that by someone who writes a letter, suicide letter, we can identify it's a real letter or someone had put in his mind that suicide is the best way and you write a letter in that way. But so they came to know after the like finding the letter, the person had that and all that. But before that, if someone find it that maybe someone is manipulating him to suicide, how can we help that kind of a person, because he's already manipulated, so we can not actually help that person reality because it's controlled by someone else.
Okay, so if I understood what you wanted to say, you are talking about the gravity, whether or the seriousness about that threat, the suicidal threat, whether it is really that a person wants to go ahead with the suicidal act, or is it just a threat to manipulate the individuals in his family or in his vicinity. So now this becomes a different issue, because whenever there was one slide where I talked about the levels of suicidal risk, and that also comes suicidal intent. Okay, now there are few individuals who have personality disorders. Now what is personality? It is our framework, the personality. हम कैसे बातें करते हैं, कैसे सोचते हैं, कैसे बिहेव करते हैं ना, ये चीज अगर नॉर्मेलिटी में बैठते तो उसको एक नॉर्मल पर्सनैलिटी बोला जाता है. बट कुछ लोगों का एक इम्पल्सिव या पर्सनैलिटी डिसऑर्डर में बहुत सारी चीजें होती है. बट अगर हम सुइसाइड वाला पार्ट बोले तो बॉर्डर लाइन पर्सनैलिटी डिसऑर्डर करके एक चीज होता है, या हिस्ट्रियोनिक पर्सनैलिटी डिसऑर्डर होता है. वहां पे इमोशनल इम्बैलेंस बहुत हो जाता है, वहां पे सीकिंग बिहेवियर बहुत हो जाता है, अटेंशन सीक करना उनका एक सबकॉन्शियस मोटिव होता है. तो अगर ये जो सुइसाइडल लेटर्स वगैरह जो होते हैं, ये अगर लिखना अगर बार बार हो रहे हैं विदाउट एनी काइंड ऑफ enactment of whatever the person has written in that thing, in any ways the person has to be taken to a mental health professional to investigate. Now what is this investigation? Like जैसे कि बुखार आता तो एक डॉक्टर अपना लिस्ट ऑफ टेस्ट देता है, उसमें से कुछ तो एक निकल आता है, उस हिसाब से उसका ट्रीटमेंट दिया जाता है. Now there are certain psychological tests, some personality inventories in which we understand कि ये जो कर रहा है, ये बार बार ऐसी चीजें क्यों कर रहा है, why there is a kind of a manipulation involved, right? See, as a mental health professional, I never believe that a person resorts to a behavior, मतलब जानबूझ के कुछ करने की कोशिश करता है, ये हम नहीं, क्योंकि we are mental health professional, we need to understand कि वो behavior क्यों वापस रिपीट हो रहा है. तो वहां पे क्या होता है कि ये पर्सनैलिटी इन्वेंटरीज में हमें पता चलता है कि ये जो अटेंशन सीकिंग जो बिहेवियर होता है या मैनिपुलेटिव बिहेवियर होता है, उसके पीछे और कुछ रीजन होते हैं. अगर वो रीजन को हम निकाल दें तो ये सुइसाइडल थ्रेट्स अपने आप बंद हो जाते हैं. तो उसके लिए बहुत सारा वर्क करना पड़ता है. इट इज अ लॉन्ग प्रोसेस. सो यस, यू नीड टू अंडरस्टैंड कि whether the intent is really very high or not. But again, and in the end, I would just conclude कि any suicidal threat, it is always and always better to be taken seriously. Okay, you might be wrong later, but then if because of just taking it very casually कि नहीं करेगा, ये ऐसे ही बोलता है, and then suddenly one day the patient just dies of suicide, you cannot do anything. And then हम सिर्फ बोलते रहते कि यार इतना बार बोलता था, नहीं करता था, इसलिए हम लोग ऐसे करते थे. You cannot do anything. Like I said, there is no cure. It is always better to take any suicidal thought seriously, any suicidal note seriously, and take that person to the professional.
Thank you so much, sir.
Welcome.
Thank you, Aisha, for the question. Thank you, sir. We have Ayman Sheikh asking, if depression came from a person, but you can't leave them, nor can you live with them, what to do in this situation?
So I didn't get, if depression came from a person, but you neither can't live them nor live with them, what to do in this situation? See, yes, it becomes very stressful, right? If I'm not wrong, he's talking about a family setup where he or she has a member who is going through depression, and then he is also feeling that the repercussions of it. So the family angle also becomes very essential. The caregiver stress also becomes very essential, and this stress also needs to be handled, because ultimately, in a emergency situation where the person is expressing suicidal thoughts, the family is, like I said, is the first contact, and they need to be, वो हेल्दी होने चाहिए, मेंटली हेल्दी होने चाहिए कि वो सिचुएशन को हैंडल कर पाए. बट अगर वही ज्यादा स्ट्रेस्ड हो रहे हैं और ये रिपीटेड स्ट्रेस हो रहा है, तो उनके लिए भी काउंसलिंग या फैमिली काउंसलिंग करके चीज होती है, वो हम ले सकते हैं. काउंसलर के पास जाके हम ये डिस्कस कर सकते हैं कि ये सब चीजों को हम हैंडल कैसे करें. दे ट्राई their own ways, but then there are medical ways in which you can handle a person who has been repeatedly showing signs of depression, repeatedly showing signs of ending his or her own life. So यहाँ पे स्ट्रेस बढ़ते जाता है फैमिली का, केयर गिवर का. तो उसके लिए भी काउंसलिंग सेशंस होते हैं. वो आपके थॉट्स बाहर आना बहुत जरूरी होता है, तभी जाके हम आपको हेल्प कर सकते हैं कि ये सिचुएशन को आपको इस तरह से हैंडल करना है.
Yes. Thank you. Thank you, sir. And there are many questions pouring. Shall we take one more question, sir?
Of course.
Avinash is saying, sir, you mentioned about TV shows as part of therapy. Can you give an example of that TV show? Can you name the TV show?
TV shows as a part of therapy, or TV shows which have shown therapy?
You mentioned about TV show as a part of therapy.
So I don't recollect any TV shows being used as a therapy, but see, unfortunately, that is the whole idea about creating this awareness. There are not many shows or not many media productions which have focused on mental health. But then yes, things are changing. The days are changing. We have this seminar that we are doing right now is a change. Now this is, and I hope there will be media houses coming up with such shows. Right now, I don't think I can think of any show that I can suggest that can be used as a part of therapy. Yes, but then like I showed you about my hospital, we have these music therapies and we have these art therapies. We have Fridays being, as you know, Friday is a blockbuster day. So we have TVs and we show movies to them. So there are a lot of psychiatry or mental health related movies that we show to the residents over there, so that they can interpret their own emotions. Yes, I used to also feel like this, but then yes, the person has got cured. So this is how we try to use it as a therapy, if that is what you wanted to ask.
All right. Thank you, sir.
Yeah.
So here we come at the end of the show, and I thank you, Dr. Kirti Tandel, for coming here, talking to us, giving your precious time. I know how difficult it was to adjust this particular time, and yet you have done that for us. Thank you very much. We're grateful on behalf of the management of Eva College, the principal, both the vice principals, and all the teaching staff. And of course, my dear students, all the attendees here. I thank you for coming here and sharing your precious knowledge. In case if these participants will want to contact you,
Yes.
Is there any way they can?
Can I just write down my contact number in the chat box?
Yes, you can do that. Definitely, that will be helpful for our attendees. Great. So thank you for that, sir. And here we declare that the session is over. Thanks.
Thank you so much. Thank you.